Lactose intolerance simply means that the person cannot tolerate lactose in their diet, means they cannot digest and absorb it. This is due to deficiency of the enzyme lactase that is present on the brush border of the small intestine, and it breaks the passing lactose into glucose and galactose. In patients with lactose intolerance, they either do not have this lactase enzyme genetically or their villi are destroyed, secondary to celiac disease or gastroenteritis. This shows a normal brush border or villi that has lactase enzyme on its tip. The lactose is broken into galactose and glucose, which is absorbed in a normal individual. But this does not happen in patients with lactose intolerance. Either has blunt villi or villi that are normal but do not contain the enzyme. This causes the lactose to be passed down into the lumen intact, this which attracts a lot of water from the vessels, causing explosive diarrhea, which is watery in nature. Along with this, the lactose, when passes down into the large intestine, it is broken down by the bacterial flora into lactic acid, which causes the stool to become acidic, and gas that causes bloating or abdominal distension in the patient. The acidic stool causes anal itching or pruritus anal. So the clinical features involve a chronic diarrhea that is explosive and watery. It is relieved when the patient fasts and there is no fat. Anal pruritus may be present and bloating. Keep in mind that there will never be weight loss and vitamin deficiencies since other nutrients are normally absorbed. Investigation include stool analysis or stool examination. In case of lactose intolerance, the stool specimen will contain no fat since fat are normally absorbed here, and the stool will also have an acidic pH due to presence of lactic acid. It will have increased osmolality due to the presence of undigested lactose. Hydrogen breath test is also used. The patient is given lactose, he ingests it, then the bacteria in the GIT ferment this lactose, forming hydrogen and lactic acid. This hydrogen is exhaled by the patient and it is detected as positive hydrogen breath test. In case of fasting by the patient or giving him lactose-free diet, his symptoms will improve within 24 hours. All this confirms lactose intolerance. Treatment involves lactose-free diet, milk and dairy products, all forms of dairy products, anything formed from milk, yogurt, cheese, creams, butter, and milk, any form of milk, any type, breast milk, goat milk, cow milk, all should be excluded from the diet. In case of infant, we give him lactose-free formula instead of breast milk, and lactase tablets are also used.